Following the birth of your baby, you'll bleed for a few days afterwards. This is because the womb is returning to its normal pre-pregnancy state and has to shed any debris or mucus left over from the birth.
Now, blood loss, Lochia as we call it, can go on for several weeks. They used to quote 6 weeks, this magical 6 weeks that everybody quotes for, you know, resuming sex and blood loss and when your uterus is gone, this magical 6 weeks. But Lochia can go on for several weeks. It could all be gone after 2, or it could go on for 8 weeks.
Nobody tells you about that before you have children, do they? It's like... my blood loss has always got better with each child and shorter.
I explain to women that it goes up and down. So you might have done the hoovering and you suddenly have a blood loss, and then gradually it'll die off for the rest of the day, going from red to brown to hardly anything, and stay like that for a couple of days. Then all of a sudden you might walk the kids to school and a bit of red comes again, and then it dies off to brown. And that is very normal. That's how it goes, getting lighter and lighter as time goes on.
And I do think that having stayed in bed for a week after the last 2 were born really, really helped.
Unless you pass large clots, a heavy loss is perfectly normal, but should have eased off by around 10 days after the birth. If you're at all worried about it, you should ask your midwife for advice and reassurance.